Hello, my name is Florian Lordick. I'm a medical oncologist based in Germany, working at the University Cancer Center of Leipzig. I'm also the current Director of Education within the European Society for Medical Oncology. We are very happy that this year at ESCO we could present the new ESMO guidelines for esophageal and gastric cancer. And there are some important updates regarding the management of localized esophageal cancer. There is the new implementation of adjuvant immunotherapy for those patients who have received neoadjuvant chemoradiotherapy and resection, which is the standard of care for locally advanced esophageal cancers, both squamous cell histology but also adenocarcinoma histology. And the adjuvant treatment consists of nivolumab, which has been shown to be superior in terms of disease-free survival as compared to follow-up and best supportive care alone. There is also news about the management of metastatic esophageal cancer and gastric cancer. We now have a stratification according to the PD-L1 status. Regarding esophageal squamous cell cancer, we need the information about the PD-L1 CPS, but also the TPS. And if the CPS is positive with a score of 10 or more, we can add pembrolizumab to chemotherapy in the first-line metastatic setting. When the TPS is higher than 1% or higher than 1%, we can add nivolumab to chemotherapy, or we can even go for nivolumab and ipilimumab instead of chemotherapy. So this is what the guidelines recommend for stomach cancer, advanced gastric cancer. Again, we have a stratification according to PD-L1, but also according to HER2. And what is new is that for those cancers that have a PD-L1 CPS score of 5 or greater, we can add nivolumab to chemotherapy. So this was really great to see these new guidelines coming up at the ESMO meeting, and they were discussed a lot in the different sessions. What we have is new data, and important data is probably the efficacy of trastuzumab deruxtecan in a Western population. I know this is already approved and in use in the US, but not everyone in the world, because in many parts the argumentation was that the data we had that far were just from the very east of Asia, from Japan and Korea. And now we have confirmation that for HER2 positive gastric cancers that progress on first-line therapy, including trastuzumab and chemotherapy, the application of trastuzumab deruxtecan leads to a more than 40% response rate and to very good survival and PFS data that we have not achieved with other available treatments in the second-line setting for HER2 positive stomach cancer. And we have also seen very new data about the combination of pembrolizumab and lenvatinib in advanced adenocarcinoma of the stomach and EG junction. This is a new development because not all of these cancers are sensitive to immunotherapy, so combinations with drugs that may sensitize tumors more for immunotherapy are now under investigation, and this combination of immunotherapy and lenvatinib and chemotherapy is one of those. It turned out to be feasible in an interim analysis from an ongoing phase 1, phase 2 trial, and also the very preliminary first reported response rates were quite promising. So this is what we have seen at this year's ESMO meeting: new guidelines, new promising treatments for HER2 overexpressing gastric cancer patients, and also new promising combinations consisting of a combination of immunotherapy and novel targeted therapies.